We're putting it on the market. With the guaranteed offer, there are no showings, no open houses, no stress. Go to markspain.com to get a guaranteed offer in your home today.
Last week on 3+U, we headed up to Cleveland to pay a visit to the Medical Center Compounding Pharmacy. This week, we are back talking once again with Cindy Smith and Amy Owenby. Thank you for letting us come back.
Thank you. Thank you for coming back.
We had such a great in-depth conversation last week, and we barely touched the surface. And you had mentioned to us, Cindy, that a great passion really of yours personally,
yes,
but the pharmacy in general, the medical center in general, is women's health. So we wanted to focus on that specifically this morning.
Absolutely. And not just because I am a woman, but in large part because through my career that I have recognized, and as I've gotten older, that there's so many needs in our demographic, in a woman's life.
Right.
And we all share things that happen to each one of us as we age. Right. Not all of us are going to have high blood pressure. Not all of us are going to have hardening of the arteries. Not all of us are going to have other diabetes. But all of us are going to have a change in our life phases. Our life cycles is what I call them. And our hormones will change. They change from the time that we become adolescents all the way through the end of our life.
Right.
And many times I find that women don't necessarily think about how those things impact their everyday life and how they affect their mood and their energy level and their ability to sleep well. And so we try to be a resource for ladies, women of all ages, to be able to consult with them, talk with them, kind of listen to what's going on with them, and just suggest things where we can.
Yeah, and we're going to talk a good bit in a second about hormone issues since you mentioned that. But I do want to bring Amy in because often you see women at a very happy time of their lives when they've had a baby. Boy, are those hormones going like this.
Yes.
But a lot of women are choosing to nurse now, and that comes with it their own questions. Y'all provide breast pumps here, right?
We do. We have a line of Medela products. We also have a rental station for the Symphony, and we work close with a local breastfeeding consultant that refers patients here. So we do a lot of items with that.
I would think that you kind of become, I know you're not a general store, but in a way you become like one a little bit, because if a woman comes in, maybe she's using a breast pump and then there is a problem, she might not know where to turn, and you, Amy, might be the person to send her somewhere.
Correct, yes. And most of the time if they are having issues, we do recommend that they speak with their breastfeeding consultant, but we can always troubleshoot anything with the company if they're having any issues with their pumps. But their consultants are very knowledgeable with that.
Yeah. Women are talkers.
Yes.
We tend to be. I would imagine when you come in here, if you just even overhear conversations being had, that might then lead a woman to ask, hey, what were you just talking about, and is that something I should know? You were sharing with me a kind of a personal story. You don't have to reveal all of it, but that got you very interested in a condition that many women may have and suffer from, and they don't even know it.
Yes. The condition is known as interstitial cystitis, and it results from the bladder becoming very, very inflamed and causing severe pelvic pain. And many times it can be confused with endometriosis or even polycystic ovarian syndrome for those members of your audience who may be familiar with what I'm talking about. But sometimes they go and they have the surgeries for the endometriosis and the PCOS, and they still have pain afterwards. And I've had several conversations with folks, and did they check you for interstitial cystitis? Well, no. Well, you might have that conversation with your practitioner.
Right.
Because the only way that it can be diagnosed is surgically through a procedure that the physician or the surgeon will actually perform while he's in the operating room or she's in the operating room.
Is it something, not to get too into the weeds, but if you have this pain, and it could be then one of several things causing the pain, would the surgery be an exploratory one to make that diagnosis or not?
I have known of those situations to occur.
Okay.
Every practitioner has their mode of practice that they follow and that they use. But it is something, some ladies actually will see a urologist rather than, their OBGYN. But both both of those professions treat this condition.
Right.
And sometimes when they recognize that, you know, maybe they have burning and things that just is not making sense, a lot of times an OBGYN may send that person to a urologist for
Right.
further definitive diagnosis.
You know, you have said before that you feel like you are a patient advocate, and you're not trying to cross a line where you shouldn't cross.
Absolutely.
But you do enjoy having these conversations with people. So again, to this IC, as you referenced it, the short term, sometimes it can be helped with lifestyle changes and food
Yes.
choices so that people could come and get some advice from you, try it, and then come back and say thumbs up, thumbs down.
I have a little sheet of dietary recommendations for someone who has IC, because IC can be triggered by acidic foods, you know, a lot of the things that we love, spicy foods, you know, even caffeine, tea, different things, tomatoes, things that you would normally think are benign, but then all of a sudden you've gone out for Italian and the next day it's like you're having all this pain and not making any sense why that would be. That could be, you know, a sign that that's something you might want to have a conversation with your doctor about. And I usually encourage ladies, you know, keep a diary.
Yeah.
You know, whether it's on this condition or other conditions, jot down how you're feeling from day to day and track it.
But we're so bad about that because we're too busy jotting down how our kids feel, what we're going to
Exactly.
make for supper. We
You
always
are
put
correct.
ourselves on the back burner. Okay, you talked about those hormones. They're there from birth and they're there as we get older.
Yes.
Every woman's walk postmenopausally is a different walk.
It is. Well, from premenopausal to perimenopausal to postmenopausal, it's a different journey. And you have postmenopausal women who have never had a problem with hot flashes, never had a problem with a night sweat. And those women, I envy them.
Yeah, we
so
can't be your
much.
friend anymore.
Yes, we're not going to be your friend anymore. But for the great majority of us, we do. We find that all of a sudden we're not able to lose weight around our middle. We are not sleeping as soundly at night. Our energy level just tanks. Our mood has become depressed. And sometimes patients are put on antidepressants or they're given, you know, sleeping medications. And when they come see me, nothing is helping. And I just will ask, well, have you had a hormone panel? You know, talk to your practitioner about checking your hormones. If someone's not on replacement therapy, because that's something that they'd have to do with their practitioner.
And that's where, though, by encouraging them to do the hormone panel, then they get their own specific hormone panel and they come to you as a compounding pharmacy and you tailor make it to her.
To the practitioner's specifications.
Correct.
Absolutely. It is a patient-specific prescription that the practitioner issues. We have some practitioners that will actually send us the labs and ask for a recommendation, but we aren't by law allowed to, even if they send us the labs and say just, you know, fix it.
Yeah.
You can't do that. The practitioner has to absolutely be in agreement with your recommendation, and then they issue the patient-specific prescription for that.
You know, my husband's grandfather was a pharmacist up in New England, and he talks fondly about the memories he had of kind of his grandfather being such a central figure in his
Yes.
little town. It used to be, when the world was bigger or smaller, depending on your perspective, that was the case. It's nice to see that some things are just true in life,
Yes.
and the need for a pharmacist you can trust is true in life.
Well, almost every pharmacist that I know, and I truly believe that there are hindrances that might be placed on the involvement of a pharmacist, you know, due to how busy a location is and the demands that are on their time. We are very fortunate here in that we can structure things to accommodate our clients as much as possible and take the time, you know, to meet with them
Yes.
and have that conversation that could lead to a good outcome for them.
Well, I think you've got a line of folks over there looking to have a conversation with you. So I'm going to wrap it up, but you can come pay them a visit, whether it's by phone or preferably in person. They are seeing patients and clients from Chattanooga all the way up into Athens. It is the Medical Center Compounding
Yes.
Pharmacy in Cleveland. They would love to make you part of that patient-pharmacist relationship.
Thank you.
Don't let psoriasis get in the way. With Taltz, up to 90%